4 days after nurses and midwives laid down their tools over salary enhancements, their leaders have suspended their industrial action for 90 days.
Having read the letter from the Minister of Public Service, having consulted with the Minister of Health, and having also consulted with my colleagues and analyzed the minister's statement that the money for the nurses and midwives, according to their agreement of 2018, will be included in the budget. There was need to suspend the industrial action.
The Ugandan Nurses and Midwives Union President Justus Cherop Kiplangat explains why they are suspending and not calling off their industrial action.
It's because we have not seen the money. You know, sometimes government can promise and cannot deliver.
During the 90-day suspension, the union will analyze whether the budget, set to come into force on July 1st, will reflect their salary increase, including on their bank accounts.
Should that money not be there in the budget, we have given them also a notice of 90 days to sort out themselves. That is 3 months. For us, we shall go back to industrial action.
However, Cherop confirmed that the decision to suspend the industrial action came with strong opposition from some of their members.
Of course, we have Thomases in this world. There are those who want to see that the money has ended. So for those who want to see the money, whether it has ended in their accounts or not, they wait.
Meanwhile, the allied health workers who laid down their tools on the 16th of May are continuing their industrial action in protest at the government's delay in raising their salaries.
They are calling off. It doesn't matter, they can call off because it is up to them. Ours is allied, and we are saying we are not calling off until government comes up to address our issues.
There are 37,000 allied health workers who include clinical officers, psychiatric clinical officers, lab scientists, radiographers, pharmacy technicians, medical records officers, orthopedics and dental technologists, among others. Since the 16th, when they laid down their tools, they have been providing only emergency services.
If government doesn't respond during this week, we shall be left with no option but to withdraw even the emergency services. That's when they will feel the pinch.
The nurses, midwives and allied workers have been threatened by government officials like the Prime Minister and the Minister for Public Service of severe reprimand for their industrial action, including a threat to be sacked. Patrick Senyondo, NTV.